Hi, I'm Dr. Eric Smouha from ENT and Allergy. I'm an otologist or ear specialist, and today I'd like to talk to you about otosclerosis.
I have hearing loss in both ears, and I'm too young to wear a hearing aid.
Well, you need a hearing test, and if the hearing test shows that the hearing loss is conductive, then you probably have otosclerosis. Otosclerosis is a disorder of the inner ear where the bone that conducts the sound gets hard. So people with otosclerosis have a normal eardrum, but the little hearing bones that carry the sound to the inner ear get stiff and don't move well anymore. The typical story is progressive hearing loss in one or both ears.
My mother had a similar issue, and when she got older, she was practically deaf.
She shouldn't have gotten to that level because otosclerosis can be easily treated with a surgical operation or a hearing aid.
What does my audiogram show?
The audiogram is the hearing test that shows the type of hearing loss that you have. In otosclerosis, the hearing loss is conductive. So the audiogram tells us that it's a mechanical problem of the ear, not a problem of deterioration of the nerve.
Would surgery really restore my hearing?
Surgery is amazing for otosclerosis. It has a success rate of 90–95% in most patients. And it's a simple operation that takes about 1 hour. We do it in the hospital under the microscope, and patients go home the same day.
What are the side effects? And can I go back into work?
There are two common side effects. One is that some people get dizzy after surgery. This happens about 10% of the time, and it usually clears up within a week or so when it does. The other side effect is a taste alteration, which is almost always temporary. The taste alteration is caused by a little taste nerve that travels under the eardrum, and we have to displace it in order to do the stapedectomy operation.
Will I need surgery in both my ears?
If you have hearing loss in both ears, you can get surgery in both ears. We always do the worst hearing ear first and allow it to heal. And if the other ear has bad enough hearing, we'll operate on that ear as well in time. Sometimes the other ear is good, and then over time it gets worse. And so we might wait a couple of years to do the second ear.
What's new in otosclerosis surgery?
Well, the surgery was developed in the late 1950s, and it's held up very well with the test of time. But what's new is we use a microscope to do the surgery. We use a laser to remove the stapes bone without exerting any force or trauma. We have an array of prostheses that crimp themselves very well and work very well to replace the stapes and give a natural sound.
What types of prostheses do you prefer?
I like the prostheses that are made entirely out of Teflon plastic. The reason is that sooner or later everybody gets an MRI in their life, and the radiologist doesn't want any metal in there. So the Teflon plastic is perfect, and it gives a great hearing result.